Welcome back, everyone, for the MRCS anatomy, and we're going to start today by the spine anatomy. And we're going to focus on two big things, which are the anatomy of the cervical spine and also the anatomy of the lumbar spine. We have a few questions in each one, and we're going to focus more on the Atlanto-axial joint and a few more questions about the lumbar spine and how to identify each vertebra and so on. So looking at this lovely vertebra, you do have, it looks like a cervical vertebra, and this is from Blue Link, Dr. Kathleen. It's a very lovely source and very important source to be honest. It's found on from University of Michigan in the USA. So it's a lovely source that I've been using it for most of the cadaveric anatomy. So thank you very much. So starting by um, how to identify that this is a cervical vertebra, you have a transverse foramen, as you see here. This is a transverse foramen, and a triangular vertebral foramen, and also a bifid spinous process, and a very small transverse process. All right, and also relatively small body as well. So obviously this is the body, and you have here this is foramen transversum, transverse process, and then you have the bifid spinous process on the back. We need to identify also the lamina and the pedicle. So going here, so this looks like the pedicle, which including from these two processes. So this is the pedicle, and the lamina on the other side will be sort of this area. That is the lamina of the cervical vertebra, and obviously here you have a bifid spinous process and a very small transverse process. This is the vertebral body, as you see here, and again this is the spinous process, and that's something called the vertebral arch as well. And we know that this is the pedicle, and you have the lamina in there as well. Okay. So a few more details or some impressions. So A and B represent the atlas, and so this is the atlas cervical vertebrae, and C and D represent the axis. Okay, we need to identify a few structures in here. So the atlas, on this one, we're looking from the top. So obviously this one will articulate with the base of the skull, or the condylar part of the occipital bone. So identifying structures, and also on the front in here, you have this is the site for articulation with the dens. All right. So if you look here, number 4 at the dens or the odontoid beak, and it articulates with number 2. So it's a facet for dens. Is number 2 is a facet for dens. You have number 7 is a posterior surface, so that will be the posterior tubercle, and you have number 6 as the posterior arch of the atlas. All right. 8 is obviously the transverse process, and obviously this is small lumen is the transverse foramen, and 5 is the lateral mass and the superior articular facet, which will be with the base of the skull. Looking at this one, it's the same. So you have here the apex of the anterior arch. So this is the anterior arch, and this is the posterior tubercle, and this is the posterior arch, and here you have this looking from inferior. So that is the inferior articular facet, and that is transverse process, and this is transverse foramen. Looking at this one, this is the second, and both of them are one of the atypical criteria. So what we looked up there, so these images were the typical cervical vertebra. But you have two atypical cervical vertebra. They do have some atypical features, and we already identified some of them. So for one, for example, we don't have any body. We cannot see a body in number 1. So one, no body, all right? Does it have a spinous process? It actually has a tubercle, so also no spinous process as well. Okay. Yeah, and also number 3 we didn't mention. So when a vertebral artery comes all the way up and into the skull, usually it passes here. So that's for vertebral artery impression. Vertebral artery impression on this side. Okay. Moving forward, so this is the dens, like we mentioned. This is the vertebral foramen, and you have here, this is the spinous process, and the criteria of the spinous process is that it is bifid in this structure, and then you have This is the superior articular facet, which articulate with this one, the round inferior articular facet on the other side, this one, all right? And also, again, you will have here the transverse foramen, the transverse process, and you have a lamina and a pedicle as well. So we'll see number 8 at the pedicle, and 7 will be the lamina, all right? On the other side, you will have, again, the same things. So the most important is a dens or the odontoid peg, and you will have the same structures. But here you have body and the second cervical vertebra, but in the first one, there is no body and there is no spinous process. So yeah, we identified all the structures in here and there, so there's no point to go through them again. This is just a lateral X-ray of the cervical vertebrae, and if you see here, if we come closer to that one, so you will see something going all the way up, as you see here, all the way up, and it articulates with something else in here. So this looks like the dens, okay? And it articulates in here with, this is the anterior arch, right? So the facet would be sort of here. So this is the anterior arch of atlas, okay? And moving down, if we want to start counting, so this is number 2, and this is 3, and this is 4, and this is 5, and this is number 6. Number 6, that looks like number here, so that is the lamina for the cervical 6. And 14, it looks like the spinous process of C7, okay? In front of here, you have a sort of black color in here, so you're looking for the basically the larynx, and obviously this will be the epiglottis as well, and 16 will be the trachea or the esophagus. On the other side, you see a shadow in here, this shadow, so that looks like the hyoid bone as well. And moving forward, yeah, so we mentioned 7 is the lamina of the cervical 6, C6. Okay, and we'll see this is the spinous process of C7. Great, which is a little bit long, as you can see in here. 3 is maybe the first rep. This is the first rep. All right, so these are the structures on this X-ray on the lateral view. Well, that's it. Just something to really consolidate it. So if you start looking in here, so again, this is the dens, which is, as you see, is quite long, and it articulates with the C1, as you see. And you have here, this is the disc in between. That's the cervical disc in between. And obviously behind this disc will be the spinal cord, which should be here, really. So this section is quite helpful to, maybe when you're studying the nose, you can use it as well. If you're studying the larynx and even the vertebrae, even the muscles and so on, you can use it for many different purposes. But this one is the disc, the intervertebral disc. So again, this is from Blue Lake, Michigan University. Okay, so Atlanto-axial joint, this is an X-ray, looks like open mouth view. You have here, basically what we're trying to identify the dens. So the dens is there, as you see this lovely structure in there. That is the dens, okay? So number 8 will be the dens. And maybe 1 is the anterior arch. 1 looks like the anterior arch of what? Of atlas. All right. 5 looks like it's the lateral mass of atlas. Okay. And 2 looks like the Atlanto-axial joint. And 3, look at 3, it looks like that. That's a bifid spinous process of axis. And here you have this at the inferior articular facet, 6 at the superior articular facet of atlas, and 4 is obviously the body or the lateral mass. The main thing here when you do this X-ray, which I think is not commonly done nowadays, we usually do CT scan. When you look at this X-ray, you're trying to find if there is any fracture or not. So maybe the next one will be a little bit more clear. So again, we're trying to identify the dens. Look here, this is the dens. Oh, there is some interruption in here, and then the dens will continue as well. So obviously that's an odontoid peg fracture. So this is an odontoid fracture, okay? And there is sort of soft tissue swelling all the way around. If you see here, soft tissue swelling all the way around. So there is reactive soft tissue swelling around it. And malalignment, if you see the distance between the dens and the lateral mass in here is different from the other one in here, there's also malalignment. So odontoid peg fracture, and there is fracture edema and abnormal alignment as well. Okay, so another question is asking about the ligaments attached to the odontoid process. So we do have a few ligaments attached to the odontoid process. So this is the odontoid peg. You will have the apical ligament, which is coming all the way up to the skull like that. So this is the apical ligament. If you remember the head and neck anatomy, we mentioned that the apical ligament is one of the contents of the foramen magnum, all right? And also we have the alar ligament, which comes on both sides like this. And again, you have the transverse ligament, which will be sort of moving like that. Okay. Ligaments between C1 and C2, you have anterior Atlanto-axial ligament, posterior Atlanto-axial ligament, and also transverse ligament as well. All right. So anterior and posterior Atlanto-axial and transverse ligament. How to demonstrate the articulation between the atlas and the axis? You might be given a model to try to articulate them. And if you look at this lovely diagram from Michigan, so you will have here, this is the dens. It needs to be sort of anterior and articulate with its facet down there on the atlas. So if you look here, this is how to articulate it. Try to identify which one will be superior, which one will be inferior, and it should be easy. So obviously, this is the lateral mass or the articular facets, which are superior and articulate with the skull. You have here the transverse foramen and the transverse process, and this is the bifidus process. This is posterior tubercle, posterior arch. This is the impression for vertebral artery, lateral mass, and so on. Yeah, again, this is another view looking from the front. This is the dens. And if you remember, I mentioned the apical ligament will be sort of attached in here. That's the apical ligament. And alar ligament will be sort of attached in here. And the transverse ligament will be sort of attached in here. All right. And here, this is the atlas up there. You have the kidney-shaped superior articular facet right there. And then this is, for example, the posterior tubercle. And this is the posterior arch. That's the impression for vertebral artery on both sides. And this is the bifidus process. And obviously this is the axis. And these how to articulate them if you're given a model. So types of joint in Atlanto-axial joint, it looks like a plain synovial joint, and intervertebral joint, it looks like secondary cartilaginous joint, and we talked about this before. The first cervical spinous process to be felt and why, it will usually be C7, the first one to be felt. And the main reason why, one, it's the longest one, and the other spinous process are usually short and bifid, and related to something called the nuchal ligament, which is a tough structure that prevents us from feeling them. So the first process to be felt is C7 because it had the longest spinous process. The others are short and bifid, and you have soft tissue and the superior nuchal ligament as well. A typical cervical vertebrae, we mentioned two of them. So we mentioned C1, actually three of them, and C2. C1, no body, no spinous process. And C2, the body projects upward to form odontoid peg, and also the bifidus process and thick spine. And C7, long spinous process and narrow foramen transverse. All right, moving forward, you will be asked to demonstrate the hyoid bone and the cricoid cartilage C6 and how to identify these structures. So hyoid bone usually 2-inch from the lower mandible, that's a hyoid bone, and the cricoid cartilage, you will go to where the Adam's apple is. Another question is asking about the structures at C6 level. And here you have the pharynx turning into the esophagus and the larynx turning into trachea. The vertebral artery enters the transverse foramen of C6. So why does it enter C6? Because C7 has very narrow transverse foramen. Superior thyroid artery enter the thyroid gland, and middle thyroid vein leave the thyroid gland and the cricoid cartilage and intermediate tendon of humeral muscle. So let's go a little bit back in that section, which we might identify C6 and all what will happen at the level of C6. So you have this is 2, 3, 4, 5, and C6. So here initially you have pharynx and larynx turning into the others, all right? So pharynx turning into esophagus, larynx turning into trachea. All right, so obviously you have here the trachea and so on. Great, and also you have the cricoid cartilage by definition. Okay, and then you have obviously I can't get the omohyoid in this section, so the omohyoid intermediate tendon will be there as well, and you have the thyroid, you have the middle thyroid vein, and the inferior the superior thyroid artery. All right. I think it's the inferior thyroid artery. Well, we're going to check that. Yeah, so these are all the structures that lie at the level of C6 that we mentioned. Sorry, superior thyroid artery enters the thyroid gland. Middle thyroid vein leaves, and the intermediate tendon and the vertebral artery enter from transverse as well. Lumbar spine, so we need to identify this vertebra. So it looks like it's a lumbar vertebra for many reasons. One, you have kidney-shaped and massive body. The body is massive and is kidney-shaped as well. You have triangular or triangular in the vertebral foramen. You have quite long transverse process and short and thick spinous process as well. All right. So this is the lumbar vertebra for many reasons. We mentioned massive body, kidney-shaped, triangular vertebral foramen, long transverse process, spinous process short and sturdy or short and thick. Structure is passing between in the intervertebral foramen. So here you have 3 nerves and ligament and vessels. So 3 nerves, right? You have a ligament and 2 vessels as well. So the nerves is dorsal root ganglia, roots of spinal nerves, and the recurrent meningeal nerves, and also the transforaminal ligaments, spinal arteries, and communicating veins. So basically, on the lower end, so if you have a section of a vertebra, which would be sort of like that, you will have a process in there, and then the spinous process, and the other one, there will be sort of something going up like that. So you will have here, this is the intervertebral foramen. That is the intervertebral foramen. So you have dorsal root ganglia, and you have the roots of spinal nerves, and the recurrent meningeal nerve, and also the transforaminal ligaments and artery, spinal artery and vein. Okay, at which level will you do a lumbar puncture? So ideally, you should do the lumbar puncture in L4-5. And the reason why we do that, because the spinal cord usually ends a newborn at L3, but in an adult on L1-2. So you're trying as much as you can to avoid L1-2 or avoid any higher level. So L4-5 is the highest point that you can do, the lowest point that you can do the lumbar puncture. And basically you can find it at the level of ASIS, anterior superior iliac spine, and the layers that you're going through, if you look at this lovely diagram. So we talked about earlier about the intervertebral foramen. This is the intervertebral foramen, and it contains the dorsal root ganglia, the spinal nerves, and the spinal artery as well, and the recurrent meningeal nerve as well. So it's 3 nerves and communicating veins, and also 2 transforaminal transforaminal, transforaminal ligament, sorry, all right? So these are the structures in the intervertebral foramen. So as you see, that's a notch, superior notch and the inferior notch joined together to form a foramen. But here in terms of the layer, you get the skin first, and below the skin there is sort of subcutaneous fat, and then you go on to a fascia after that. So these are all the basic layer. And then you go to the ligaments, which you have 3 ligaments. 1 is the supraspinous ligament, 2 is the interspinous ligament, and 3 is ligamentum flavum, which will be sort of here. And I'm going to show it to you in a second in a better dissection. So these are the layers that you go through. And after ligamentum flavum, you will feel a give or a go away from you with the needle. And you will go into the epidural space, and following the epidural space, you go to dura mater and subdural space, and then arachnoid mater, subarachnoid space. But we're basically, we want to reach the subarachnoid space and get some fluid. Okay, so let's look at this lovely diagram. So that demonstrates to you that this is the spinal cord, obviously. You have this at the spinal cord. And just here, this is the subarachnoid space, and this one is the arachnoid mater, okay? And that thick structure is usually the dura mater, all right? Which obviously you can hold it with a forceps. So here, the target is you go to the epidural. So if this is a needle in there, the target is to go to epidural space, dura mater, and then subdural space, arachnoid mater, and subarachnoid space. So that's your target at the end. Okay, but I didn't show you yet the ligamentum flavum. I'm sure it's coming at some point. So the movement of the spine, the lumbar spine, is usually flexion, extension, and lateral flexion as well. The contents of the spinal canal, just below the level of L2, it contains conus medullaris and filum terminally. Conus medullaris and filum terminally. These are the structures, which is multiple thin fibers going all the way down from the end of the spinal cord at L1-2 all the way down to the coccyx. As you see here, this is where even the sac, the dural sac, will terminate, and the filum terminal will even continue down up to the coccyx. All right, so this is filum terminal. So that is my source. Okay, just a quick question. Tumors metastasizing to the spine, and these are the lytic lesion or sclerotic lesion. Sclerotic usually prostate, and lytic lesion, I think we mentioned this bit before. And the location of prevertebral venous plexus, I would classify it so to external and internal. And internal veins. So you have here, this is external vein, will be sort of here. And again, there is another external vein in there, right? Or external venous plexus. And you have internal veins, which they will be sort of here. Okay. And there is another one in there as well. Okay. So how can you name them then? So you have external. So this one is external and anterior. So anterior, external. And this one is external and posterior, so posterior, external. And you have anterior, internal, and then posterior, internal. All right. So let's talk about where they are. So anterior, external, usually in front of the vertebral body. Posterior, external, usually on the spinous process. And anterior, internal is between the dura mater and the body, and or anterior to the dura mater, and posterior internal is posterior to the dura mater. So these are how to remember them quite easily. So external and internal, and both are anterior and posterior, and these are the locations for all of them. Thank you very much. That's done with the spine anatomy.